Hello, hello, welcome, welcome, welcome. First of all, I want to just say, as a general statement, the 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 growth that you guys have had from vignette 2 to vignette 3 is like off the charts. So excellent job on those vignettes this week or last week. You have another one this week. But no, I mean, like, the growth that you guys have had from that to this was phenomenal. So very well done. The other thing is, I want to say to those of you that are veterans, have loved ones who are veterans, um, husbands, significant others, dads, grandpas who served in our armed forces and in our military. I want to say Happy Veterans Day coming up this week, and also give a plug for the honor run. If you enjoy running, if you enjoy supporting our armed services, then I encourage you to check out the honor run if you're in Northern Kentucky. It's something that I do every year, and I have for the last 5 years. And it is a great run. There is a 5K, there is a 10K, there is a half marathon. I have done the 10. I do the 10K. I'm not quite to the half marathon yet, but maybe one day. But I do the 10K, and it's a great time because they support the 101st Airborne, and support for those who have fallen. So there's nothing that quite gets me more than when we're starting out. We meet at the Florence Water Tower, and we start on our outrun, and they've got a American flag that has flown in several deployments. And you run through the start finish line, and you touch that flag, and you know that it's been involved in numerous military operations, and you're running for a cause, and it's a good one. And I always want to support the military, support armed forces, because they're who allow us to do the things that we do. And so, shout out to the armed forces, shout out to the military, shout out to those that serve, and keep us safe, both domestic and abroad. So, be doing that. I'm filming this on the 8th. I'll be doing that tomorrow morning, to honor those who have served. So, Veterans Day, it's very important. So there you go. So what are we looking at today? So today we're going to look at three modalities. We're going to look at cognitive behavioral therapy, or CBT. We're going to look at eye movement desensitization and reprocessing, otherwise known as EMDR. And we're going to look at 12-step facilitated treatment. In other words, the 12 steps. So that's what we will focus on today. So let's go right into it. Let's look at cognitive behavioral therapy. Now, when we talk about treatment modalities, this is kind of the first one that most people learn, or that most people get skilled at. Okay. So this is kind of your McDonald's of treatment, right? It's a catch-all for kind of everything. I don't mean that to be dismissive. I mean that to say this is kind of the building blocks of what we do with treatment, okay? And with the modalities that we would use to help someone in who is struggling with addiction, certainly with behavioral health too, but again, that's not the focus of this class. But in addiction, connecting those actions, behaviors, consequences, how one thing connects to another, that's cognitive behavioral therapy. Okay, so this was developed in the 60s by Aaron Beck, and the premise of it is basically our thoughts control how people view their environment and themselves. The primary focus is going to be on behavioral modification through redirecting the thoughts. Okay. So our thoughts are then connected to our actions, and then those are connected to you can also say, the behaviors, and then we end up with the consequences of whatever may come. Okay. So it is, as I said before, it is the Swiss Army knife of therapies. I've got my little multi-tool that I carry with me. So in here, I've got a knife, I've got some pliers. What else is in here? I thought I had a screwdriver on here somewhere, but I guess I don't. I have another one that's got a screwdriver, but it's got wire cutters, wire strippers there in the middle. So there's this one thing can be used in a variety of different avenues. You can also use it as like a makeshift hammer if you really need to. It's not recommended for that, but you can do it. So this one tool, this one thing can be used for a variety of different purposes, and that's what cognitive behavioral therapy is designed to do. Okay, so that is, again, kind of the baby's first therapeutic intervention. That is what cognitive behavioral therapy is. Okay, so 3 core tenets. Our psychological problems are based in part on faulty or unhelpful ways or patterns of thinking. And then psychological problems are based in part on learned patterns of unhelpful behaviors. So we've had faulty or unhelpful ways of thinking that have led to faulty or problematic learned patterns of unhelpful behaviors. And people suffering from psychological problems can learn better ways of coping, thereby relieving their symptoms and becoming more effective in their lives. Okay, so let's break it down with a visual. Ooh, if I can get to it. There we go. In other words, our thoughts create our feelings create our behaviors, and our behaviors reinforce those thoughts that then create feelings, that then create behaviors, that then reinforce thoughts, that then create feelings, that then create behaviors, that then reinforce thoughts, that on and on and on and on. And so if I get stuck in a faulty way of thinking, then I'm going to get stuck in faulty ways of feeling, or that's going to influence my feelings. As I feel something, that then leads to a behavior. As that behavior comes through, it will reinforce the thought that I had, and so on and so forth. So if I get caught thinking that I'm a terrible person, then anytime something comes up where I could give myself grace, I don't, because my thoughts are telling me that I'm a terrible person. Well, that causes me to feel bad about myself. Well, what do I do when I feel bad about myself? Okay, I could go journal. That would be kind of healthy, but that doesn't always take the pain away. Well, what does? Well, I'm feeling really bad about myself. I want to go out and have fun with my friends are calling me out to go out, and then I say, "Hey, have a drink." And so I have a drink and I find that I'm like really relaxed, and that actually really kind of helps. And so I want to go do that again. And it just turns into this reinforced feedback loop. Okay. So let's look at it in another context, a social gathering. If I have again, thoughts create feelings. So if I have a thought that people don't like me, then that can lead into people don't like me because I am, insert the negative thing you feel about yourself. Right. And so because of that, I will then either isolate, try too hard, self-soothe, seek safety. That then reinforces the fact that people don't like me. So if I'm going into a social situation with this underlying idea that I'm not liked or I'm not likable, then I will maybe unconsciously or unintentionally act in ways that could reinforce that idea. So if I think that I have not, like if I'm of the belief that there is nothing that I can offer, then I just may not talk. Well, if I'm not talking, people don't get to know me. And if people don't get to know me, then I can't make social connections. Well, if I don't make social connections, it can't be that I didn't put myself out there. It has to be that people don't like me. And that loop just gets reinforced over and over and over again. Okay. So you can see how all of these things are connected. What we want to try to do is break through some of this stuff. So you say that people don't like you. Tell me more about that. Where does that come from? Have there been situations where people, tell me about situations where people did like you, or, so we can even press in on some of that. Okay. So nobody likes you. No one has ever liked you ever at all. Well, okay, there was this time that Okay, tell me more about that. You see what I'm saying? So like we can get stuck. And so part of what cognitive behavioral therapy is designed to do is to reframe some of that stuckedness to then create new feelings about ourselves that could potentially create new behaviors. Okay. So what's the goal of cognitive behavioral therapy? We're going to look to redirect or rewire the thought process. What we want to do is we want to develop mindfulness and grounding skills to help bring it all back to what our present moment is. We want to look at how to stop our thoughts or redirect our thoughts when we have them, and reinforce the idea of positive self-talk, because that can negative self-talk can help to reinforce some of this other stuff up here, right? One of the things that tends to happen is that when people start thinking negatively about themselves, they will say, well, I don't know how to think positively. So then you say, well, did anybody teach you how to think negatively? Well, no, it just kind of happened. Okay. So it just naturally sort of happened for you. That may not happen with positive self-talk, but you can identify the negative self-talk and meet it in that space with something positive. So trying to just rewire some of these things. Now, for a lot of your patients or a lot of the people that you're working with, you're dealing with 10, 20, 30 years of reinforced stuff. Well, our brain gets really good at forming those very strong bonds to stuff like that. So patients within like 2 or 3 months may get really frustrated. They can get kind of aggravated that, well, I'm not making a ton of progress. Well, that's okay, because you've just been learning how to do this new thing for a short period of time. So giving them some grace in that area can be really helpful. Okay. So again, we're trying to find a space that we can intervene. People don't like you. Well, why would you, where is that coming from? People don't like me because I am ugly. I am this, I am that. I am weird. I am whatever. Okay. So if that's, we may not try to challenge that, but like, okay, well, if that's the case, how do you respond? Well, what would it be? I wonder what it would be like to maybe try this different way. Well, what if you thought about it in this perspective? Tell me about a time where you felt safe or you felt secure. So you're just really kind of playing with some of this to try to shift some of those thoughts from being super negative to super positive, or from being super negative to being somewhat positive, but also you are challenging the idea of who they are and how they connect these things together. Okay. So really trying to, upend this system. Okay. So how does it work with substance use disorder? It's fine. It's very broad. It's very easy to apply. It's something that can at least set a basis if you've got someone that, this is their first or second time through recovery, or they're really trying to just understand it on a basic level. It can work really well. But like I said before, it's the McDonald's of therapies. It can be applied to a number of different situations and can be reasonably effective based on where the patient is at. If you're dealing with super deep trauma, probably not going to be a great fit there, but it can at least can bridge them to get to a place where we can use some of these other modalities to focus on trauma. Okay. So 12-step facilitated treatment, or 12 steps. This stems from the Minnesota model, which is an abstinence-based model. It's created by Hazelden up in St. Paul, Minnesota, the Hazelden Betty Ford Clinic. It utilizes the 12 steps of AA along with cognitive behavioral therapy or motivational enhancement theory or motivational interviewing to focus on acceptance, surrender, and moral inventories. It's very popular in residential facilities and addiction centers. In fact, most of your residential facilities will use some version of 12-step facilitated treatment because it's very straightforward, especially in this area that tends to be pretty popular. And it's a way to get people connected with their spirituality, to get people connected to some sort of a structured kind of program that can help them find their recovery. Okay. So let's go through the steps, because oftentimes I have found that when we talk about 12-step and we talk about 12-step recovery, that there are times that people have never even been exposed to what the 12 steps are and how they actually work, or they have a very rudimentary understanding of exactly how the steps are the process that you're supposed to go. Now, here's the difference, the big difference between this modality and like an AA meeting. Oftentimes when you see it in this context with 12-step facilitated treatment, it's connected to an evidence-based practice. The thing about the 12 steps and 12 steps as a general concept, the AA community, is that there's no standardized way of approaching how the steps are supposed to be utilized. There are some support groups out there that are abstinence only, meaning like no medication-assisted treatment, honestly not really much psychiatric help, like in terms of like Prozac, Zoloft, etc., psychotropic medications. You're just supposed to do your inventories, do your step work, come to meetings, get with your sponsor, and that's kind of the structure that you're supposed to do. That can scale all the way up to kind of more liberal, and I don't mean that in a political way, but they're more progressive, I should say. In that, no, medication assisted treatment can be super helpful. Like there is even some mention in the big book about potentially using LSD to kind of help open up one's mind. Like that is an option. And so there is no standardized way of this is what you're supposed to do. And that has a benefit because somebody can create a meeting no matter where you're at. Like you don't, that's a great benefit to how the steps actually work. But the problem is there's no standardized thing. So it depends on how somebody interprets the big book, interprets how they run their, or like connects to how they, approach somebody that's recovering. So there's no standardization. Now, most of them will run it the same way, which is generally fine. But you may run into a situation where somebody's going to meetings and it's more of a social gathering than it is like let's work on our recovery, and they can kind of push back against some of that. Or it can turn into a church service that sometimes people can push back against. So I'm giving you that caveat because later on we're going to look at support groups. And so there is a differentiation here between what we do in the 12-step facilitated treatment, TSF, and going to a support group. And the difference is the standardization. So this, what we're talking about, is standardization. So let's look at the steps. So the big first step, we admitted that we were powerless over the substance and that our lives had become unmanageable. 2, came to believe that a power greater than ourselves could restore us to sanity. And 3, made a decision to turn our will and our lives over to the care of a God as we understood him, Number 4, made a searchless and fearless moral inventory of ourselves. And then number 5, admitted to God, ourselves, and our another human being the exact nature of our wrongs. Now, I put the 5 here because 1 through 5 have a vibe and 6 through 12 have a vibe. And we'll talk about the differences as we get there. So 1 through 5, you will see this is where patients will stay more often than not, or people in recovery, because these are the one, like steps 1 through 3 kind of are in a cluster. Step 4 is its own thing, and step 5 is its own thing. So steps 1 through 3 are basically saying that our lives have become unmanageable and we need to turn our will over to something that is greater than ourselves. Now, when we say God can be anything. Literally, it can be anything. Oftentimes what happens is that God turns into big man upstairs, which is fine. But in theory, the God can be whatever you want it to be. It could be a significant other. It could be your children. It could be your job. It could be the community that you're in. It's just something that is bigger than yourself. It can be the spirit that you connect with, whoever. Like that can be your God. You're basically saying that if left to my own devices, in this current state that I am in, I don't know that I can make effective choices. And the choices that I'm making tend to gear towards really being selfish. And so I'm going and I'm using a substance and it's creating a lot of problems in my life. And now my life has become unmanageable. Okay. So I can't do this on my own and I need help with it. So I am turning my will, the things that I may want to do, over to something else. So if I'm having a bad day, and historically my decisions would have led me to go use alcohol, instead of doing that, I think about, well, what would my higher power, let's say it's my kids, how would my kids respond if they saw me to go drink? Or how would my kids feel if I made that decision? Or what influence does my children have over me making these decisions? Or how can I connect with them? Maybe I need to connect with my kids instead of connecting with alcohol. Okay. That's a very basic, it's very basic, but I'm wanting to emphasize that if I were to say God, big man upstairs, yeah, that's an easy concept. Like I'm going to turn my will over. It's not me, but God. But it doesn't have to be God. The guy in the sky. It can be a spirit, an energy, something. It can literally be anything. That I am not going to filter everything through my own decisions, but it's through the decisions of this other stuff. Okay, that makes sense. Okay. So 4 made a searching and fearless moral inventory of ourselves. This can get a little bit. I'm having problems with my ears because of my allergies. So if you see me do this, anyway. It's basically like, what were my contributions to the problem? Now this can get kind of hard because it depends on your sponsor. It depends on somebody's sponsor what they do with this. That how do we look at our morality through the lens of the decisions that we've made? Okay. So basically, what are my contributions to this problem? Where was I wrong? What did I do wrong? Now, it can get a little weird because if we do a moral inventory, that can go back years if they want to. And sometimes it can get a little bit blame and shamey that can create some problems for people. So I have worked with individuals that are doing step work and they bring in their fearless moral inventory to me because they've been working on it with their sponsor. And they talked to me a little bit about that. And one of the things they go back to is like they got raped when they were 15 or sexual assault when they were 15 because they were at a party and they got drunk and somebody took advantage of them. And so the challenge in that space is that, like, should that have happened? Well, probably not, whatever, but we don't want to take the focus off of what happened, which was someone, the perpetrator, took advantage of you. And that's not right. And so what I see sometimes happen is there can be some wires crossed. So you have to be very careful with how this process works. We don't want to shame someone because, well, you shouldn't have been at that party. Well, maybe not, but that other person shouldn't have done that to them, and that's not their fault. So it's learning how to keep a patient out of the shame space. Then that shame can then be directly connected to the decisions that they make. So there's a little bit of nuance when it comes to searching and fearless moral inventory because you don't want people to go into the shame space, and that can create problems down the road. Admit it to God, to ourselves, and another human being the exact natures of our wrongs. So we're basically saying, here are my faults, and I'm acknowledging these. I'm bringing these to the surface so that we can work through them. Okay. So again, as I talked about, higher power, God as we understood him. People can get a little bit hung up on that. Understandable. Does not refer to a specific deity, more of a spirit or a power. And as I said before, can literally be anything. So here's the rest of them. Number 6, entirely ready to have God remove these defects of character. Humbly asked him to remove our shortcomings, made a list of all persons we had harmed, and became willing to make amends to them all. Number 8 is a sticking point sometimes. Number 9, made direct amends to such people wherever possible, except when to do so would injure them or others. 10, continued to take personal inventory. When we were wrong, promptly admitted it. Number 11, sought through prayer, meditation to improve our conscious contact with our God as we understood him, praying only for a knowledge of his will. And number 12, having had a spiritual awakening as the result of these steps, we carried these messages to alcoholics and to practice in all of our affairs. So, the first 5 have a vibe, and these 7 have a vibe. Basically, it is, here is how I have sinned, essentially, and here is how I'm trying to make up for it. And that's what these are designed to do. Number 8 can people can get hung up on. 8 and 9 can be tough because I have to make a list of the people that I'd harmed, and that can be really, really challenging for people. And then number 9, the making amends, can be really difficult because it's tough. If you know that your substance use caused an impact on a past relationship, should you really go back and try to contact that ex and admit your shortcomings? That's tough. That's a tough space. That could emotionally injure someone, could emotionally injure the other person. So we may just need to ask for forgiveness for ourselves in our own personal time instead of trying to go through, the process of reconnecting, because that could be harmful. Okay. So again, a little bit of nuance. Now, sometimes when people get through the steps, they think it's done. That's actually not true. Step 10 tells that very specifically and very directly. We're going to continue to take personal inventory. So when I hear somebody say that they got through the 12 steps, cool. Now you're on step 10 and you kind of stay on step 10. Because it is a constant process of continued inventory. The steps are really, in theory, never completed, because the goal, especially with step 10, is that we continue to take inventory. And then step 12 is basically I am going to continue to live the principles in all of our affairs. Okay. And carry that message of hope to other people who are struggling. Okay. So how's it work? Well, depends on how you ask. There's a lot of evidence showing that there is a significant amount of efficacy, but there's also some evidence showing that there's not. Okay. So it just depends on who you ask. Here, from this study that I've got down here, findings increase supportive evidence for the hypothesis that 12-step involvement, quote unquote, works. 12-step meeting attendance and involvement appear to lead to a decrease in subsequent alcohol use. Well, that's one study. Here's another study that's kind of showing there really isn't a lot of difference. And in fact, when you just did AA, you have, only 7% improved as opposed to some of these other things. Those that are abusing alcohol kind of stayed the same thing. Those that are dead, again, still a pretty big number here. Now, there is a lot of but that goes into this, which I completely understand, because it's all in how we define some of these terms. For someone that is in AA or that does 12-step recovery, there is this idea that, once you are an alcoholic, you are always an alcoholic. But from a clinical standpoint, if you've not used alcohol in 12 months, we don't have anything to clinically diagnose you with. So there is some, it gets a little weird. It gets a little gray how we start to define what some of these things are. So that's really the challenge with trying to determine does this stuff work? As terms of like broadly. Individually, yeah. For individual people, it can be something that is life-changing. And many of you have kind of talked about that in your discussion board posts, that your sober support community is like your lifeblood. And that's great. But there's others that community can actually turn them away from recovery. And that can be a little bit challenging when we look at it from a scientific standpoint. Okay. So again, depends on who you ask, which is why it can be limiting sometimes if you have a program that like the only thing you want to do is 12-step recovery. So differentiate your services. All right. So the challenges is like the emotion tied into 12 steps because of there is sort of this underlying emotion that exists there. And quite frankly, the person that is doing the treating, if you've got somebody that is a very like abstinence only, then presenting this stuff to somebody that is really kind of struggling can feel restrictive. It can feel like you're not really meeting them where they're at. Okay. And it's also tricky because, as I mentioned before, sober support meetings can be so diverse. Okay. So we'll switch gears. Finally, we'll talk about eye movement desensitization and reprocessing, otherwise known as EMDR. EMDR is awesome, and I just got trained in it and certified in it back in February. It is a really, really cool modality, and I've really had a lot of fun putting it into my clinical practice. So basically, when a traumatic or a very negative event occurs, information processing may be incomplete, perhaps because of a strong negative feeling or dissociation interfering with information processing. For instance, a victim of a crime may know that criminals are responsible for the crime, but that information does not connect with the feeling that they are responsible for what happened. An example of this is PTSD. So let me give it to you in a different way. We all have needs, okay? And so our needs start even when we're born, but we may not have the words to be able to describe what those needs are. As babies, we can't say, hey, mom needs some milk, but we do cry because we feel this thing in our body and we communicate it in the only way that we know, which is to cry and be fussy and cause fuss. It is up to those that respond to us to be able to meet those needs. And so we develop this connection. We develop this relationship. I cry, need get met. Cool. That is there, and I can be secure in that to where I know that when I cry, I will get my need met. All right. So then we get a little bit older and our needs are still relatively the same. Hey, mom, come change my diaper, give me food, blah, blah, blah. As long as that is there and is consistent, then we're good. Right now, I get to be 6, 7, 8 years old. And now my needs shift from being kind of strictly physiological to now we're into like emotional needs. I still need these things met because a lot of this world around me is very confusing. It's very big. I don't know what I'm doing. I'm trying to figure all of this stuff out for the first time. And so this person that I have entrusted is supposed to be there to help me in that process. Well, let's imagine, and I know underneath the surface, I need them to survive. So I need my parent to survive. Fundamentally, that's something that I have to have. Okay. Let's say something goes wrong in that system and I have an emotional need and my parent comes to me with shame. You should have known better. What is wrong with you? Or they hurt me, right? Or they just don't respond. Well, I still have this need that needs to be met. So let's just go with the they don't respond. So I have this big emotional need and they just really don't respond to what my needs are, whether they're just kind of absent or dismissive or not interested. But I still have to have this need met. Well, I need to kind of keep the peace here because I need this connection with my parent. So what I'll do is I will create an adaptive response in order to try to get that need met. Now, perhaps what I do is I become super independent, right? So for those of you that are super independent, my guess is there was an attachment wound from childhood or from adolescence that signaled to you your need won't get met here, but you still need to keep this peace. Stepping out and asking for help, you either get shame or you either get dismissed. So you just need to take care of it on your own. Or you can't trust anybody. Or you're not worthy of having that need met. And if that's the case, then I'll just take care of everything myself. Okay. So our body can feel something and our brain can tell us something completely different. Okay. Because people come and go. People are just going to be people. But what they leave with us are the feelings associated with whatever was going on. So what eye movement desensitization and reprocessing allows to do is to try to realign those two spots. So I may know that I'm a good person. I may know that I am a hard worker. I may know that I do a lot of really good stuff. But my body experiences is something very different. My body experience it as something that like I'm not good enough or people don't really care about me. And so what EMDR is doing is it's reconnecting those things to where they're now in balance, okay, to where they're now aligning with themselves, okay? So it's not exclusive to like these big traumas that we talked about. Smaller traumatic events can also have an impact. So the smaller things can stir up things from the past, a feeling from the past. Okay. So how does it work? We're going to link these memory components. Okay. So we develop what's called a negative connotation or a negative belief. I'm not good enough. I'm not worthy of love. I'm not strong enough. I'm broken. I'm damaged. I'm whatever these negative beliefs are. Right. Because whenever we get hurt or harmed by people or by our environment, it isn't the outside. It's something that it stirs up inside of us, right? So when the boy breaks your heart and you start feeling not good enough, it's not the boy. He's just the thing that stirred up the thing inside of you. You are good enough just as you are. You are enough as you are. You are worthy of love and respect regardless. So whatever happens externally, that's for them. You don't have to claim that. All right. And that's what EMDR is doing, is it is connecting these two thoughts together. Okay. So mindfulness, we're just noticing things that come up. We don't really want to change them. Free association. So as we process, we're just asked to report on any new thoughts, insights. I'll do some check-ins. I have a score that I do. I have a SUD score, or subjective units of distress or disturbance. That I'm going to check in with patients from time to time to see, how are you doing? How are we feeling? Where are we on this process? Okay. And then we're going to stir up whatever comes up. We're going to access it. And then as they're accessing whatever feeling it is, that's when we do the eye movement, right? Because we're connecting both parts of our brain, rational and emotional, and connecting them, trying to connect them together. Yes, I feel sad that this thing happened, and I'm still worthy of love regardless. Okay. That's the dual attention stimuli. So we're going to do, as we go through EMDR, we do a history. Then we're going to do prep work, such as creating a safe space, creating a calm place, creating a perfect place, creating containers. So many good things that we do to help with mindfulness and grounding. Then there's going to be the assessment. So we create I put triangles up on the board, And we talk about, we walk back from a patient's first experience, where the present experience, whatever's coming up, and then we walk that back through their childhood. Then we flip it and we try to focus on, well, what do we want to look like and how can we use that moving forward? We're going to desensitize them to that thing. So whatever comes up, we're going to do this. I'll do the eye movement. That kind of desensitizes them to the stimulus that's coming up, whatever is distressing to them. Looking at new insights, new ways of thinking. And then we're going to update that positive belief. So we're going to change it from I am worthless to I have worth and value regardless. Okay. And then we're going to do body scans for any disturbances and then clear them all out at the end of session. It's actually really cool. It's really powerful. It takes a while to get kind of to the meat of it. Like I don't start doing the eye movement until like session probably 5 or 6 because we got to do such an extensive background in history. But it's not bad with substance use disorder. Still very early in its application, and a patient needs to be mostly stabilized. So this really wouldn't work for somebody that's in probably their first 3 to 6 months of their recovery. It's not going to be really effective. There are so many other things that need to be worked on first. But being trauma focused is very, very big for this population, and it's important. So that's what we got this week. If you want more information on EMDR, reach out to me. I can meet with you and talk about it. It's really, really good to help people get through their stuff. Again, I gave a basic overview, but as you do your deep dives into your work, you should see some good stuff. That's all I got. Hope you have a great week. I hope everything is going well. We got a few more weeks left, and then we will be done. So getting to the very, very end. So have a great week. Enjoy yourself, and I will see you very soon. As always, Canadian Geese are definitive proof that evil exists. Live mahalo. See you next time. Goodbye.